I don't want to be strong like man who look pretty. I want to be strong like bitch that fight bears in the forest.
Welcome to another episode of Bitch vs. Bear with your hosts, me, Amber, my bestie, Sydney.
Woo!
We are co-owners of Shield Maiden Training Co., and this is a show where we bitch, laugh, and chat about all things fitness and wellness related to women and the LGBTQIA plus community.
That is what we do.
It
I
is-
almost forgot to woohoo.
You almost did.
I know. I took a breath
there
and
was a
like kind
pause.
of was like pausing, and I was like, "Oh shoot, that's me! I
You
gotta
have a
do
line.
something." This thing that I just inherently do did not just come in that one.
I was like, oh no, is she gonna woohoo?
Is there a woohoo?
I threw it to her and she's not taking it.
I'm over here like watching plastic bags float through the wind. Yeah,
All right. What are we doing?
we are talking about what is normal in the context of health and wellness. Like when you're going to
Fantastic.
your doctor. And so like
Mm.
when your doctor is like, everything looks normal, and that like lovely blanket statement,
Hate that statement.
we're gonna dive into what does that actually mean?
Awesome.
Where do they get that information? Like how do they determine what is normal?
Yeah.
Because I'm sure you've heard that when you're sitting in the doctor's office and they're like, yeah, everything looks normal, and you're like, I am far
Okay.
from normal.
It doesn't feel normal, but okay.
Yeah, exactly.
All right. All right.
Okay. So almost worse than hearing your doctor tell you news diagnoses is getting that phrase.
Mhm.
All your tests came back normal.
Yeah, I was
Well,
very upset with that.
what the fuck does that mean? Like, what the fuck is normal? So, in the context of a medical diagnosis,
Mhm.
normal, air quotes, typically refers to the range of values or conditions that are considered within the healthy or expected range
Okay.
for a particular parameter or aspect of health. So, normal ranges can vary depending on factors such as age, sex, and obviously individual health characteristics. But it's really just like a range. And the
Got it.
doctor has decided that your age, your sex, all of these things, you fall within that range. You're good. You're normal.
Great.
Yeah.
Great. So, an example of normal is vital signs. So, normal ranges for vital signs like heart rate, blood pressure, respiratory rate, and body temperature are well established based on population data. Deviations from these ranges may indicate potential health issues. Makes
Wait,
sense.
perfect example. When you have a temperature,
Mm.
9 times out of 10, that elevated temperature means that you have the cold or flu, right? Like we know that. And like being kids, it's like, oh, one, you're kind of burning up. Like, okay, you're no longer within the normal range. There
Right.
is an issue.
So it's important to note that what is considered normal can vary among individuals, and healthcare professionals take into account the overall clinical picture when making diagnoses. Sometimes deviations from the normal range may not necessarily indicate a health problem, and additional factors such as an individual's medical history, symptoms, and risk factors are considered in the diagnostic process. Reading is hard for me today.
Apparently.
Goodness. Okay. It's important for our doctors to not only understand what is normal generally, but also specifically what is normal for us.
Yeah.
Yeah.
And that's, I think, the biggest kicker. Because if
Yeah.
you don't have a long-standing relationship with your physician, how will they know what's normal for you? Like if
Right.
you're always bebopping around to different physicians, which I know can be hard because like it always seems to come. I don't know if you run into this problem, but every time I find a physician I like, they're like, I'm retiring or I'm like selling the business. And I'm like, but we were just getting good.
For me, I've moved so much
Mm,
that like half the time I don't even bother finding a new doctor in my new place. To be honest.
you just go to the witch in the forest. You're like,
Yes.
you're more stable.
I mean,
I can always summon you to where I am.
my primary healthcare provider is the cereal.
The witch doctor. I love it. Okay, so physicians and healthcare professionals assess normal ranges in various areas to monitor and diagnose a person's health. Pretty simple. There are some key areas where normal ranges are commonly considered.
Mhm.
So you may have heard of these referred to as what we set up top, the vital signs. Like
Yeah.
if you're watching any doctor show, like take the
Doctor
vitals.
shows.
Oh my god, yeah, right? Like so it's like from ER to Grey's Anatomy to like all of them, like those are the things that like they jump right to. It's like,
Right.
you know, BP's falling.
The BP is always falling.
The BP is always falling because if your BP is falling, shit is going wrong because your heart is not able to keep up and keep pumping blood.
That makes sense.
Yeah. So it means either you're losing too much blood, there's something wrong with your heart.
Mm.
Like so
It's always something wrong with the heart.
yeah, it's always something wrong with the heart. So, vital signs, super important and you should understand what your vital signs are for a multitude of reasons, but especially if you're just somebody who bounces around, you don't have a primary care physician, because sometimes doctors will take your vital signs and be like, well, that's weird, but it might not be weird for you. It just might be weird for them assessing you because they've never done it before.
Fair. Yeah.
Yeah. So, heart rate, the normal range for an adult resting heart rate is typically between 60 and 100 beats per minute.
100 seems high for resting.
Some
Wow.
people,
They
some
rest
people
hard.
they rest hard. Body temperature, 98.6. I will say I run a little hotter.
Mm.
No, that's incorrect. I run a little colder. So when my temperature, I tend to be right around like 98.0. So when
Mm.
I actually have a temperature, it's closer to what most people's normal is.
Gotcha.
So
Okay.
people don't realize, like the doctor will be like, "Oh, your temperature's fine." I'm like, "Actually, that's a little elevated for me."
Okay.
Blood pressure, normal blood pressure, that's BP for those of you who aren't in the lingo of all of the doctor shows. Normal blood pressure is generally around 120 over 80, but it can vary based on age, sex, and individual health factors. So this is one of those
Yeah.
things, as you get older, your blood pressure fluctuates. But generally, for our listening audience, most of us should be 120 over 80, somewhere in there.
Nice.
Yeah.
Okay.
So blood test, this is one of those ones where like your CBC, if you're in
Mm.
the, get a Chem 7 and a CBC. So
Mm.
CBC is a complete blood count. So
Okay.
it measures and evaluates red blood and white blood cell counts,
Mm.
hemoglobin, and platelets. So they look at that as like a holistic kind of thing, not just one of those.
Gotcha. Okay.
This is one that I think should be probably utilized more. And
Mm.
I
Okay.
think people are learning more about it, but that's our blood glucose. And so that's our blood sugar.
Right. Okay.
And so for us, normal fasting blood levels are typically between 70 and 100 mg slash DL. So it's just like how much sugar is in our blood.
Mhm.
Obviously, for diabetics, they test their blood more regularly. It sugar is both good, your body needs it, and elevated, especially for Americans,
Mm.
because we have so much added sugar to things to make them
Right.
taste good, and it is very addictive. And so our sugar tends to spike and fall much more
Ah.
rapidly.
Yeah.
And so it's an important kind of factor when you're talking to your doctor. And if you haven't had like a blood glucose or an A1C to know kind of what you're looking at with that, I highly recommend it
Hmm. Okay.
because yeah, we in America, we like our
Yeah.
sugar and we have a
Do.
tendency to have it in a lot of processed things. And so,
True.
yeah, this one probably I don't think of as a vital sign, but probably like when a doctor is
Mm.
doing, we're going to get into some of our like more specialized vital signs.
Okay.
So a lipid panel, older folks might have this as more regularly, but it's going to be measuring cholesterol levels, including your LDL, your your HDL, and your kind of total cholesterol. So when people are
Gotcha.
like,
Okay.
I have high cholesterol, that comes from a lipid panel.
Okay. Okay.
Yep. Liver function tests. So
Ooh.
assessing liver enzymes and other markers for liver health, because liver, your liver filters out all of the toxins. Quite
Works
a
hard for some people.
Yeah, it works hard for some people, some more than others.
Mhm,
Um,
mhm.
and so it can be a really important thing. And most people probably don't have a ton of liver tests done. You
I
probably
mean,
don't
yeah.
need to. But for some, it can be
Yeah.
an important vital sign.
Fair, fair.
So there's kidney function tests, which they measure your like blood nitrogen and other like just they do all these things. They look at like how your kidneys are filtering out all of your urine and things,
Ah,
which when you see like the doctor shows and they're like, "There's blood in the urine," like that's
something's
probably
wrong with the kidney.
yeah, like you have perfect kidney. That's
Love doctor shows.
I love doctor shows. Um, so then urinalysis. So you're examining the urine for abnormalities such as like extra protein in their blood
Mm,
and glucose.
okay.
So
Yep.
yeah, that's where we get some of that.
Great, great.
Vital signs imaging studies. These we're probably familiar with, right? So
Yeah.
X-rays, CT scans, and MRIs. So they're looking for normal findings depending on the specific area being examined.
Yeah. Makes sense.
So that could be bone structure, organ function, and soft tissue abnormalities.
Mm, okay. Yeah.
Yeah. Now we're going to start to get into the fun heart stuff.
Ooh.
The electrocardiogram, or ECG, or EKG if you're in the doctor shows.
Is
Yeah.
it supposed to be ECG and they call it EKG?
Yeah, ECG is like the newer,
Oh,
yeah.
okay.
So this measures the electrical activity of the heart to assess heart rhythm and identify potential abnormalities.
Which
Like,
always seems weird to me. Like you're you're measuring electrical things in my body.
yep, it's cool.
Like I know that that's a thing, but it doesn't make sense.
Yeah.
The
So
little electrical impulses in my brain can't compute.
I'm electric. Um, and then you have for like kids and babies, you're gonna have like those developmental milestones that they're
Mm,
looking for as
yeah.
part of vital signs. So those pediatric doctors are going to look for things in their motor skills, language, and social interactions, assessing ranges for like mood, their cognition, their behavior, especially in like psychiatric evaluations.
I guess.
Yes. So you know,
I feel like there's got to be a wide range for for kids in their milestones. Like
yeah,
one just develops a little differently.
exactly. And so it's important for them to have those as part of their kind of vital sign,
Mhm.
but also it's hard because some, like you said, some kids just develop at different rates.
Yeah.
And so it's not necessarily a good full picture when you're just using that
Right.
information.
Makes sense.
Um, and that's why when you go to like an emergency department with like a kid,
Mm,
they run full panels of everything because
I don't know.
they don't know. You,
Mhm.
everybody's a little bit different in how they present,
Yeah.
and it's like this might be normal for this kid, but it's very different for another kid, and so like they tend to just order every test. They're like, "Oh my god."
Just do everything.
Yeah.
I mean, that makes sense. Like I've heard that kids who grow up in like a bilingual household, their language skills, not that they develop slower, but they develop differently.
Mm,
So like they're not hitting the milestones that you would normally see with a single language household. I don't know. But like once because they're learning both at once, right? So like
that makes
it kind
sense.
of hits later, but then
Yeah.
they're bilingual.
Yeah, but then they're bilingual.
So like,
Yeah,
yeah,
that makes sense. Oh, that's really fascinating.
right?
So
Like,
fascinating.
yeah, I heard that somewhere. I was like, Yeah, that makes sense.
Yeah,
So, like, if you don't have that context, you're like,
exactly.
"Oh, this kid can't speak in full sentences. They should definitely be doing that by this age."
Yeah.
And you're like, "Well, but wait.
But wait, because they're
They can
actually taking in
speak
twice the amount of
yeah,
information that just a single speaking household
yeah.
would be giving their kid. Yeah.
They can speak partial sentences in 2 languages."
So
So there.
so they've leveled up. And then there's the endocrine system. So sometimes vital signs will be evaluating hormone levels such as thyroid hormones, sex hormones, and insulin.
Mhm.
So it's there's a lot of things that could be and that are considered vital signs. And it's important for us as individuals who have control over our own bodies and our health to
That makes sense.
understand what those vital signs mean for us in particular.
Mhm.
So, like, yeah, it's all great and wonderful to know what like blood pressure is supposed to be, but
Right,
if you don't know what yours is consistently, you'll have no way of advocating for yourself.
right.
When your doctor is like, "You have high blood pressure," it's like, "No, actually, I don't."
That's actually pretty normal.
That's pretty normal for me,
Yeah,
you know?
that makes sense.
Yeah.
I mean, I kinda um like, I know our I think our Whoops did it, and my Fitbit does it now, of, like, in a f like, I think it's, like, 5 categories, it will, like, track your vital signs or
Mhm.
your vital data, and, like, I've been wearing it long enough now that it's like, "This is outside of your normal range." Like, "This is
What are you
within.
doing? Are you okay?
Are you breathing? Because
Your
you don't have that
respiratory
many."
rate seems really low.
Which I think is really interesting because it at least, it's probably not the most accurate thing in the world, but it at least gives us an idea of what
Yeah, it's a jumping
seems
off
normal
point.
for us.
Yeah.
Yeah.
There are some benefits to those wearable devices, and I do think that they have helped in a lot of regards because people can very quickly look down and be like, wow, my heart rate is really elevated.
Yeah.
This is outside of its normal range. What's going on? Obviously, did I just go run a 5K or like, am
I've
I
just been sitting
stressed?
here.
Yeah. Well, I'm just sitting on my couch and all of a sudden my heart rate jumped up. Like, what the is going on? Um, and I mean, I've read stories where it's like, my Apple Watch saved my life because, like, yeah, it triggered when I was having a heart attack and I wouldn't have
Oh,
known because, like,
yeah.
just sitting there, you're like, I feel a little off, but we all can have those moments.
I feel off all the time. Like, that's just
And then it
baseline.
becomes your new normal, right? So, like, how do you then determine? But
Right.
if you have a wearable that's like
Wait a minute.
bells and whistles going off. Um, so I do think that there are some benefits around the wearable devices
Yeah.
outside of like what we probably think about using them
Yeah.
for sure.
Yeah.
Not that you should necessarily need to go out and buy one, but if you
No.
have one, it is cool to look at that data and see
Yeah.
what you can kind of discover from it. Like I know my my elevated heart rate. I know what I can push to when I'm working out. And my max is higher because I've been working out and I
Mhm.
have pretty good endurance and stamina, even in my slightly larger form than I am right now. Um, and I know that I can kind of push my max heart
Mhm.
rate, which based if you just did the general math of like my age times blah blah blah,
Right.
it should I should be probably 10 to 15 beats per minute lower than what I can push my max to, but that's good for me to know.
Right.
And it allows me to be like when my doctor's like, I'm like, I actually have pretty good endurance. And like, because I can consistently hold that higher rate. And so it's just kind of cool because then you can push yourself in the gym. You can do a bunch of other
Yeah.
things without being like, am I dying? And
I
it's like,
think I'm
I
dying.
think I'm dying. My heart rate is 181, but I know I can actually withstand and hold like 178 to 181 without just passing out,
Yeah.
which is a pretty high max heart rate. And I can hold that for maybe like a minute or two. But I mean,
Yeah.
I think our max heart rate is supposed to be at like 175 or 170,
Oh, good. Okay.
something like that. No, I don't know. Like, again, max. So, it's just interesting, and, like,
Yeah.
again, without that, we wouldn't know what our normal is.
Right. And that's the important thing, right? Like, it's all about knowing your medical history.
Yeah.
So by law, we are entitled to our medical records. if we
How many of us have those, right?
remember to go get them. So to do that, call any healthcare provider you've already seen and ask for an authorization for the release of information form. Laws differ from state to state, but most facilities are allowed to charge a reasonable fee for copying and sending records. Keeping your own medical records can help you track what your normal is. We'd love to believe that our physicians review our entire medical record before our appointments, but that is not realistic.
They're just they're just reading a manual of our medical record.
Right? Especially if you're me, who never remembers who her doctor was in a previous state that they saw once, or maybe didn't see at all at their last location. So, yeah, so not realistic. You, however, are in charge of your own health.
Yeah, Amber.
Yes, I know. And having your records easily available will allow you to track trends and communicate what is normal for you to your doctor. For example, your doctor takes your temperature and it's a little high, say 99.1. But over the last 10 years, that has actually been your temperature at all but one physical. You can let your doctor know that, and they can utilize that information rather than trying to figure out what's going on with you and if you have something going on.
Yeah, they're not sitting there being like, I don't think you have the flu because you
Right.
haven't.
And you're like, no, actually, that's just me.
I just run hot. Like,
Yeah.
whatever. Okay,
You don't
99.1
waste.
might be a
That's a
little
little high.
high, but
But you get the gist.
you get the gist. Yeah,
A little up, a little down. Maybe that's your norm.
exactly.
And instead of wasting time trying to figure out if you're sick,
You can
you
move
can just
on.
say, no, that's normal. This is what's actually wrong.
Exactly. Because, like, they can get a little lost in the weeds too, right?
Yeah.
Because, like, that is typically an indicator. And so it's helping your doctor not get lost in the weeds. And going back to a couple episodes ago of like really utilizing that time, we
Mhm.
know they don't have a shit ton of time. And so let's not spend our 15 minutes going over things we know are normal for us.
Yeah. Talking about our abnormally high body temperature. Like,
Exactly.
no, let's move on.
Let's move on. Yeah.
So ultimately, the concept of normal is a guideline rather than a strict rule. And healthcare professionals use their expertise and judgment to interpret findings in the context of each patient's unique circumstances. Context is important.
Context is so important. So, what is normal is really relative to you. What is your normal?
Yeah.
And so you need to be the person in charge of figuring that out, not your doctor.
Good luck, Godspeed.
Yes.
Go see the witch in the woods. She'll help.
Go see the witch in the woods, figure it out, be in charge of your things, and then normal is just the thing for you.
There you go.
There you go. See? Debunking going to the doctor or making it easy.
I mean, within reason.
I mean, yeah.
If you constantly are bleeding from your eyeballs, that's not normal in any context. Go see your doctor.
You mean I shouldn't be bleeding from the ears all the time? No, I'm kidding.
No, you should not.
We are expecting that our listeners understand.
You're all smart people.
Yeah,
We
exactly.
trust you not to use our words against us.
Exactly. Well,
Awesome. So keep
cool.
listening.
Yeah, definitely keep listening because it's, man, this whole year is going to be so fun. I'm so excited. We have a couple, I think our next episode is going to be just a wow.
Oh, good.
Yeah. I think it's okay. It's going to be one that people can hopefully feel really connected to, unfortunately, because I think it hits on something that a lot of us feel and don't know what to do with that.
Fair.
Yeah. And I feel like we've all been there and can relate to one another, but it's not something that gets talked about a shit ton.
Makes sense.
Yeah. So stay tuned. Listen in next week. It's going to be
We're
fun.
not going to tell you what it is.
Yeah,
You just have
no.
to come back.
This is called a cliffhanger.